Chapter 7, Ventilation, Perfusion, and Shock, along with understanding pathophysiology. Some of the topics we'll be discussing today are the cell, the cardiopulmonary system, shock, and also the pathophysiology of other systems. So pathophysiology is the study of how disease processes affect function of the body. So as you understand how the disease processes affect the body, it really helps you recognize the changes that the patient is going through, and it also helps you anticipate what may be coming down the road if you can understand how the disease processing is affecting their illness or injury. So let's briefly talk about the cell. Cell membrane protects and selectively allows water and other substances in and out of the cell. The mitochondria converts glucose and other nutrients into adenosine triphosphate, or ATP, which gives fuel for cell functions. And remember that without ATP, many of the cell's specialized structures can't function at all. Metabolism is the process of turning nutrients into energy at the cellular level. So under normal circumstances, this process requires glucose and oxygen to be able to do so. Diagram of the cell. We're not going to go into a real detailed analysis of the cell. This is kind of a real overview, high-level overview of what the cell is and function. If you progress on to advanced care, such as paramedic or something like that, this will be covered a lot more in depth. But at the basic level, we don't really do this. So water and the cell. The cell needs the correct balance of water both inside and outside. So if you have too little water, the cell becomes dehydrated and dies. Whereas if you have too much water, the basic cellular function becomes interrupted. So water also affects levels of electrolytes, so it's going to impact your electrical functions as well. Glucose is used as a building block for energy, so the supply of insulin must match the body's glucose requirement. Too little, and we can run into problems, and of course too much. So as far as oxygen in the cell goes, there's a couple different types of metabolism that we're going to talk about. Aerobic is cellular functions that do use oxygen, and anaerobic metabolism are cellular functions that do not require and do not use oxygen. So as you can imagine, anaerobic metabolism creates much less energy because it doesn't have the need for oxygen, but it does create much more waste. The body becomes acidic, and it can impair many of the bodily functions. Anaerobic metabolism typically occurs when oxygen is depleted or absent. It's a very inefficient method of creating energy. Let's talk about the vulnerability of cells, organs, and organ systems. There's many diseases that alter the permeability of a membrane. Too many to list at this point in time. But remember that ineffective cell membrane can allow substances into the cell that should not be there, which is how some of these things become more of a problem. So these substances can interfere with the regulation of water, regulation of glucose, or anything else like that. The cardiopulmonary system. So as we talked about in previous chapters, respiratory and the cardiovascular systems work well together. They bring oxygen into the body, they distribute this to the cells, and they remove waste products. Any breakdown can result in system failure. An old adage in EMS is, air goes in and out, blood goes round and round. Any variation of that is bad. While it is a little bit humorous, that is very true. So here's the airway. Starts at the top with the larynx, goes down into the trachea. The trachea does what we call bifurcates or splits into the left primary bronchus and the right primary bronchus, or we also call it the right main stem. As the bronchus goes down, it creates secondary bronchus, tertiary bronchus, and bronchioles. Each bronchiole terminates a tiny little air pocket called the alveolar sac, So the alveoli are encased by networks of capillaries, and this is where oxygen and carbon dioxide are exchanged between air in the alveoli and the blood in the capillaries. So as airway is concerned, you must have an open or patent airway for the system to be able to function well. Anything can occlude that. Upper airway obstructions are very common. Usually this is done by some sort of foreign body, some sort of infection which causes trauma or swelling, or trauma itself causes some sort of obstruction to the airway. The lungs are considered part of the lower airway. So when we calculate things like tidal volume, this is the volume of air moving in and out during each breath cycle. If you calculate and multiply tidal volume times respiratory rate, you'll get the minute volume, which is the amount of air moved in and out of the lungs in 1 minute's time. Any change in tidal volume or respiratory rate is going to reduce the minute volume, which makes sense. If you're taking tidal volume times respiratory rate, any variation of that is going to increase or reduce that. Respiratory dysfunction occurs anytime something interferes with the minute volume. So any disruption of respiratory control, these respiratory controls are controlled by the portion of the brain called the medulla oblongata, and even further in the medulla oblongata you've got the pons, which control your respiratory rate. Any event impacting the function of the medulla oblongata or the pons can affect your minute volume. Any sort of infection, the introduction of drugs, toxins, or trauma. Disruption in pressure. So if the wall of the thorax is compromised, such as a puncture due to a rib fracture or anything like that, shooting, stabbing, anything that would create a penetrating injury, the ability to inhale and exhale is impacted, and therefore the minute volume will be reduced. Air or blood accumulating in the chest or the pleural space is also going to compromise respiration because the lungs can't expand as much as they need to during inhalation. Any disruption of lung tissue caused by trauma or medical problems can also compromise the ability of the alveoli to exchange gases. If less oxygen gets in, then obviously less carbon dioxide is going to get out. So this is going to result in low oxygen levels, or hypoxia, and high carbon dioxide levels, or hypercapnia. Just like with anything else, when the body senses that something is wrong, the body attempts to compensate. So this is no different. In the respiratory setting, the body attempts to compensate for gas exchange deficits. So our chemoreceptors are going to detect changing levels of oxygen and carbon dioxide, and therefore it's going to stimulate the brain and the respiratory system to increase the rate and or the tidal volume to make up for that difference. The blood itself has 4 parts. It's got the plasma, which is the liquid. It contains the red blood cells, which carry oxygen, carrying hemoglobin. White blood cells is to fight infection, and platelets are to help form clots. When looking at and discussing plasma oncotic pressure, there are proteins in plasma that attract water away from and around the cells, and it pulls it into the bloodstream. Hydrostatic pressure is water pushed back out of the blood vessels towards the cells. If we've got a problem with any of these proteins, this can cause any sort of imbalance. Without enough blood, oxygen, and carbon dioxide, the blood can't be properly moved around. So we're looking at problems associated with this, such as bleeding, dehydration, anemia, or liver failure. Here's an illustration of the blood vessels. On the left, or in the red, you've got the artery. On the right, or in the blue, you've got the veins. And in the middle, you've got capillaries that mesh between the two. So the blood vessels are going to take oxygenated blood from the lungs via the heart to capillaries. So this is where your gas exchange is going to take place between the cells and the capillaries. And then it's going to return the blood to the lungs via the heart for gas exchange, also between capillaries and the alveoli. In order for the cycle to work correctly, we need to have an adequate blood pressure. This is controlled by changing the diameter of the blood vessels, either bigger or smaller, for our body to regulate the correct pressure. This is done by stretch receptors as they monitor the overall pressure in our bodies. This pressure can be increased or decreased depending on the situation that we need. In blood vessel dysfunction, we could have a loss of tone, so vessels lose the ability to be able to constrict and dilate, thus causing the blood pressure to drop. Some of the causes of this are trauma, infection, or an allergic reaction. In this illustration on diagram A, you see a normal blood vessel and it's completely full of blood, so it's maintaining the blood pressure adequately. If the body senses that the blood pressure needs to change, it will either constrict that blood vessel or it will dilate that blood vessel. In illustration B on the right, you see that we've got a dilated vessel with reduced blood volume. So the vessel is too big for the amount of blood that's in there. So this is going to result in a low blood pressure. What we need is for that vessel to constrict to bring that blood pressure back up. Excessive permeability. This is when capillaries leak fluid out of their walls. A lot of times this is caused by a severe infection called sepsis, but it can also be seen in certain diseases and also high altitudes. If you've got a permeable capillary, the increased permeability allows too much fluid to escape through the capillary walls. In hypertension, or systemic vascular resistance, SVR, we've got pressure inside the vessels, and various conditions lead to abnormal constriction of vessels. But ultimately, this leads to a dangerously high blood pressure, or hypertension. Major risk factors in stroke and heart disease is hypertension and increased blood pressure. The heart is the pump. It's going to pump with an average stroke volume or output of about 70 milliliters of blood per contraction. For the heart, stroke volume is based on preload. This is the amount of blood that returns to the heart. Also, it's based on contractility, how hard the heart squeezes, and the afterload, pressure the heart has to pump against to force blood out into the system. So to measure cardiac output, we take stroke volume times beats per minute, and that'll get you your cardiac output. Slowing heart rate or decreasing stroke volume is going to reduce your overall cardiac output. Very fast heart rates are also going to reduce the cardiac output. Just because the heart's beating really fast does not mean that it's adequate. The reason is the inadequate time for heart to refill between contractions. So when we talk about dysfunctions of the heart, we can have mechanical problems or we can have electrical problems. Mechanical problems can be caused by physical trauma, squeezing forces, or cell death, such as a heart attack. Your electrical problems are going to be caused by damage to the heart's ability to regulate the rate. So putting it all together with a cardiopulmonary system. Remember that the entire cardiopulmonary system must work together in order to be able to sustain life. There has to be a good balance between ventilation and perfusion for the system to be able to work properly. Any breakdown in this system is going to impact the ratio, causing possible life-threatening situations. Let's talk about shock. The important components of shock are perfusion. This is the regular delivery of oxygen and nutrients to cells and removal of waste products. A lack of this is called hypoperfusion, which is a breakdown in the system and can ultimately result in death of the patient. Ultimately, when you think about shock, this occurs when the cells lack the oxygen they need for proper metabolism. So there's 4 categories of shock that we'll go over: hypovolemic, distributive, cardiogenic, and obstructive. It's important that we recognize the signs and symptoms of compensation. So when problems arise, just like we talked about earlier with the cardiopulmonary system, the body is going to attempt to compensate. So your signs of compensated shock are going to be slight mental status changes, increased heart rate, increased respiratory rate, a delay in your capillary refill time, pale, cool, and clammy skin, and sweating. Pathophysiology of the other systems. Fluid balance. As you guys may know, body is 60% water. We've got intracellular is 70%, intravascular is 5%, and interstitial is 25%. So as far as fluid balance goes, the brain and the kidneys regulate thirst and the elimination of excess fluid. Blood plasma proteins pull fluid into the bloodstream, and cell membrane and capillary permeability regulate the flow in and out. When we have disruptions of fluid balance, we're looking at potential signs and symptoms of dehydration, which is a decrease in total water volume. If we have poor fluid distribution, where water is not getting to where it needs to go, or we could have edema, too much water in some parts of the body. This is common in your CHF patients or congestive heart failure patients. They'll build up an excess amount of fluids, and fluid works with gravity, so you'll see swollen feet, swollen ankles, swollen calves, things like that, because the body can't distribute that water the way that it needs to. The nervous system, we talked about earlier, is comprised of the brain and the spinal cord, and they're very well protected by the skull and the spine. So it's going to be covered by several protective layers, or meninges, and a layer of shock-absorbing fluid called cerebrospinal fluid. Obviously, these are still subject to damage from trauma or disease, but the body protects it the best that it can. In nervous system dysfunction, this can be caused by trauma due to motor vehicle crashes, a fall, or diving accidents. Some sort of medical dysfunction, such as stroke, infection, such as meningitis or encephalitis, diseases such as Lou Gehrig's disease or ALS, or MS, multiple sclerosis, or low blood sugar, hypoglycemia. The endocrine system secretes hormones through glands. These hormones send chemical messages to the body, and they control the bodily functions. Your major organs of the endocrine system are going to be the brain, the kidneys, the pancreas, the pituitary gland, the thyroid gland, and the adrenal glands. Dysfunction within the endocrine system, this could be caused by organ or gland problems. This could be something that's present at birth or as a result of an illness. You could have too many hormones, called Graves' disease, so too much thyroid hormone, or you could have problems with the heart rate and temperature regulation. You could also have a problem with hormones such as not enough, such as what we encounter with diabetes. The digestive system, this is going to allow food, water, and other nutrients to enter the body. The major organs are going to be the esophagus, the stomach, and the intestines. Talking about digestive dysfunction, impacts hydration levels and nutrient transfer, especially with gastrointestinal bleeding. So this can be something that's slow or chronic, occurs over a long period of time, or it can be massive and it can be very quick. Typically you're going to see this with rectal bleeding and or the vomiting of blood. In regards to vomiting and diarrhea, it's one of the most common disorders of digestive dysfunction. Lots of things can cause it. Illness, obviously, food poisoning, and it may result in malnutrition and dehydration, especially if you're nauseous and vomiting and have diarrhea for several days, not able to keep anything down. It's likely that this could result in dehydration. The immune system is responsible for fighting infection. It's going to respond to specific body invaders by identifying them, and then it's going to mark them, and then it's going to work on destroying them. Hypersensitivity to something, or also known as an allergic reaction, could be an allergic reaction to certain foods, certain drugs, or other substances, and it's the result of an exaggerated immune response. So these chemicals affect more than just the invader. So this could be a seafood allergy or a shellfish allergy. You could be allergic to, one of the common ones is penicillin for drugs. It can cause you to break out in hives and itch. Or it could be other substances. It could be a number of things that you are allergic to. Bee stings is another common one. So this hypersensitivity or this allergic reaction is going to produce edema. and it's going to result in a rapid drop in blood pressure. So if this isn't taken care of quickly and effectively, it can ultimately be life-threatening. Remember that pathophysiology allows us to understand how negative forces impact the normal function of the body. And it also helps us understand how common disorders can cause changes and sometimes drastic changes in the body. Understanding how the body compensates for insults shed light on the signs and symptoms we may see during the assessment, and understanding what compensation looks like will help us rapidly identify those signs and symptoms and treat the potentially life-threatening problems. Remember that cellular metabolism requires a constant supply of oxygen and glucose. Absence of either of these components disrupts normal metabolism. And cardiopulmonary system combines the functions of respiratory and cardiovascular systems to provide oxygen at the cellular level. Shock occurs when the cardiopulmonary system fails and cells become hypoperfused. The body is composed primarily of water, and this fluid is distributed throughout the body systems. Some questions to consider. When evaluating a patient with a cardiac problem, consider the impact on the respiratory system. When evaluating a patient with a respiratory problem, consider the impact on the cardiovascular system. What impacts do problems in these systems have on each other? Remember that the lungs, or the pulmonary system, heart, blood vessels, and the blood itself, or the cardiovascular system, work in concert to perform cardiopulmonary functions. The primary function of the cardiopulmonary system is to deliver oxygen and nutrients to the cells and to remove waste product from the cells. These basic operations rely on the coordinated movements of blood and air together. Interruption of any of these parts of this balance results in a compromise or even a failure of the system. Shock must be recognized immediately. What is the pathophysiology of shock? Remember that shock occurs when the regular delivery of oxygen and nutrients to the cells and the removal of their waste products is interrupted. Without a regular supply of oxygen, the cells are going to become hypoxic, and they have to rely on anaerobic metabolism, remember, which is very ineffective. Lactic acid and other waste products accumulate and harm the cells. Without the removal of carbon dioxide, this buildup of harmful waste products is going to be accelerated. Unless it's reversed, shock will kill the cells, the organs, and eventually the patient. So, critical thinking question. You're treating a patient who was recently released from the intensive care unit with a massive infection, or sepsis. This has impaired the patient's ability to regulate the size of the blood vessels. How might this affect the patient's ability to compensate for any additional illnesses? What steps should you take to help this patient compensate? So this patient's sepsis will affect the body's ability to dilate and constrict blood vessels, thereby decreasing its ability to regulate blood pressure in response to any additional illness or injuries. The BLS care for shock should be initiated to include oxygen, warmth, and a position of comfort. ALS should consider fluid therapy. This concludes Chapter 7.